If we have a history of sexual assault, when a patient comes to you, of course you're going to see like the blood sample or like the stain sample, and you're going to see the history or the examination of the injuries and the bruises and all sorts of stuff. Apart from that, you are going to see a pregnancy test. If that is negative, when I give the contraceptive, ASAP, and which contraceptive you can use the Levonorgestrel or stuff like that. So the first thing is to see the pregnancy and give medications accordingly in terms of the medications. You're going to see this for examination and all the investigation. But for the medication, the first thing is the contraception. Second is to prevent a PID and UTIs and all the infection you have to give the antibiotic for the bugs, and which are, for example, you have to give azithromycin for the chlamydia infection. You have the ceftriaxone for the gonorrhea infection. For trichomoniasis, you can give the metronidazole. You can give hepatitis B or C, a hepatitis B vaccine and the immunoglobulin as well. Addition is presented within the 72 hours, within the third day. So you can give the HIV medication as well, which is like the tenofovir and emtricitabine and telkinavir and all sort of stuff, right? So these are the medication that you need to be vigilant to give the patient as well as the emergency contraception. And then you can give like the support to the patient and then send them to the well-being to look for mental health. And if they're like suicidal or not, and if they are like having PTSD or the shame or guilt or anger or frustration, then you need to look for the mental health as well. But the first thing, what you need to do is to look for the infection to treat and the contraception to prevent pregnancy. That's what we're going to do first.